Okay guys, for this video, let's just sit back, relax, because we're gonna be getting a little high in altitude. So let's get started. What's up guys? Welcome back to Patho and Chill. Today we're gonna be talking about high altitude illness. So real quick, what are possible symptoms that can happen whenever one goes up high in altitude? So that basically it has to do with headaches, any GI disturbances that'll cause nausea, vomiting, and then also sleep disturbances. Okay, let's dive into what actually happens to the body and how the body responds once we're high in altitude. So as we start to climb, say like a mountain, the atmosphere pressure tends to go down. And so to put in perspective, sea level is normally 760 millimeters of mercury in pressure. And at the top of, say, Mount Everest, we are at 253 millimeters of mercury. So yes, the atmosphere has significantly gone down. So what does this mean in terms of oxygen availability? So the partial pressure of oxygen in the atmosphere is always going to be 21%, meaning that no matter where we are, whether it's sea level or at the top of Mount Everest, it's going to be 21%. So the problem basically arises when the whole atmospheric pressure at the top of the mountain is 253 millimeters of mercury, because now the partial pressure of oxygen that is available to us in that specific altitude has significantly gone down. So what is this decrease in partial pressure of oxygen going to do to us? So now we're trying to breathe in, right? And it's going to start to get a little harder. Why? Because of this decreased partial pressure of oxygen. So basically the alveoli also have an internal pressure. And so it is this difference, the difference in pressure between the alveoli and then the atmospheric pressure, that will allow the air to flow in. And so because there's a decreased difference in those pressures, because now the partial pressure of oxygen has gone down, there's basically going to be a lot less airflow into the lungs. And so because there's a decreased airflow into the lungs, we're now not getting as much oxygen into the alveoli, meaning that the partial pressures of oxygen inside of our alveoli are also decreasing. And now we have an even less gradient to basically move oxygen from the alveoli into the capillaries, the pulmonary capillaries, and into our bloodstream. So now, because there's not as much oxygen in the blood, now hemoglobin is basically not as saturated as it could be. And as you guys already know, hemoglobin is in charge of delivering oxygen into all the various different tissues in our body. So now that you're not properly delivering oxygen, you start to see where the potential problems begin to arise. And not only that, but hemoglobin has this like equilibrium potential with oxygen in the blood, meaning that as the more saturated that hemoglobin is with oxygen, the more it allows for oxygen to diffuse into the blood, because it'll want to equilibrate and reach this type of equilibrium. So now that the hemoglobin is not as saturated, well, now there's even a lower gradient for oxygen to want to move into the blood. Other types of issues that this whole falling apart can cause is there's going to be an increase in blood pressure. The arteries are going to start to dilate, which allows for capillaries to start to leak, which will then lead to pulmonary edema and cerebral edema. So once again, everything is just going to crap at this point. And so now we start to see how there's a deterioration in our ability to give oxygen to all the other tissues in our body. And so now they can't work as efficiently, right? Without that oxygen, they can't metabolize, they can't create as much ATP, and thus they basically start to fail because they can't meet the needs and the demands that the body requires of them. So basically they start to fail, and one can start feeling dizzy and faint, and then potentially die if you're at such an elevated altitude. Okay, but I know you've been wondering this whole time, now how is the body going to start to adjust or compensate for everything that's going on, all this madness? And that's basically, we start to hyperventilate, because the body basically starts to say, we're not getting enough oxygen, like we need to start breathing more, right? And so basically we're going to start increasing our tidal volume and also the rate of our breathing. So once again, we're hyperventilating, we start breathing faster. And so we basically have two types of chemoreceptors, right? That control our breathing in our body. The first ones are central chemoreceptors that are located in the medulla, and these basically only respond to carbon dioxide. Meanwhile, we have the peripheral chemoreceptors that are basically the carotid body and the aortic body, located in the carotid artery and in the aorta, in the arch of the aorta. The peripheral chemoreceptors mainly respond to oxygen levels. However, they still have a little bit of response to levels of carbon dioxide and hydrogen ion. But for now, let's only focus in their response to oxygen. So as we've been mentioning, this increase in altitude basically leads to decrease in oxygen levels. And so this decrease in oxygen levels starts to stimulate the peripheral chemoreceptors. And so they will start firing more frequently and initiate action potentials that will go up our body and then back down via the phrenic nerve or thoracic nerve that will basically stimulate the contraction of respiratory muscles. And so as these muscles contract, right, they allow the lungs to expand, giving the lungs more space to expand. That will basically decrease the internal pressure within the lungs and the alveoli, and thus create a bigger difference in pressures between the alveoli and basically the atmosphere to allow more airflow into our lungs. So now little by little, the body is starting to increase breathing rate, right? So we start breathing frequently, but what does that actually come with? As we breathe out more often, we're basically depleting all the carbon dioxide levels in our body. So we keep breathing it all out. And so what exactly happens is this carbon dioxide is being exhaled out of our body. So now we're in a state of what is known as hypocapnia. And so basically we don't have as much carbon dioxide within our body to convert to bicarbonate and hydrogen ions, which leads us to this alkalotic state. And so what are the various symptoms of being in an alkalotic state? Well, that goes from dizziness to tingling in our hands, feet, basically all of our extremities, and thus potentially fainting. So this response from the body didn't actually fully help us out, so to say. However, there's still additional acclimatization effects that can go on within our body. The first one being renal compensation. So basically the kidneys will start to excrete any bicarbonate left in the body that will then lower the pH back down to kind of neutralize this alkalotic state. Additionally, the body will start producing more red blood cells, and the more red blood cells, then we have more hemoglobin. Thus, we have a greater capacity of grabbing onto any potential oxygen that's incoming. And so additionally, there's also increases in the 2,3-bisphosphoglyceric acid, which basically interacts with hemoglobin and has a greater affinity for hemoglobin. And once it has this greater affinity for hemoglobin, it basically allows hemoglobin to release any additional oxygen. So by releasing it, we're basically we're shifting the hemoglobin curve to the right and allowing tissues to get more oxygen from hemoglobin. And so lastly, the peripheral chemoreceptors also stimulate the increased loss of sodium and water that will thus decrease the plasma volume within our blood. And by decreasing this plasma volume in our blood, we are concentrating the red blood cells and the hemoglobin so they can act more efficiently. Now, obviously, this adaptation that I just described is going to happen in a place that is not that high of altitude. I mean, if we are extremely high in altitude, all of these effects that we talked about previously will basically take over and the body will not be able to respond. However, this is commonly seen in places like Mexico City that have a very high altitude. And so basically you have a lot of athletes that go train at these places that have high altitude, such as like Mexico City, for various sporting events like the Olympics, that will basically increase the amount of red blood cells they have, increase the molecule of the 2,3-DPG, giving them an increased advantage to other athletes because now they're able to deal with lower levels of oxygen, so they'll basically be able to perform at a higher level. However, yeah, like I said, if you are doing this at places of very, very, very extreme high altitudes, then the body's not going to be able to compensate and you will likely die. However, I hope this video helped. If you enjoyed it, please make sure you hit the like button down below, go subscribe, go check out my other videos. I hope you're having a relatively chill day, and peace out.